Hello everyone, I'm a dentist and this is my first YouTube video. I will be discussing about dental scaling or dental cleaning in details in this video. I decided to choose this topic because there are so many of my patients who come to me for the cleaning, but they're just so afraid to get the treatment started because they have so many questions in their head, they have so many myths, they have so many confusions. So finally, I'm here to just resolve all the doubts, to just clarify what scaling is, and is it actually harmful for your teeth or it is beneficial for your teeth. So guys, if you Google it, you can find a lot of information for anything, right? But trust me, only a dentist can tell you the real facts about the same. I will be uploading a video on various topics of dentistry. So if you want to keep yourself updated, do subscribe to the channel. Now let's get started. Let me start off with what is dental scaling, okay? So dental scaling is a commonly routinely performed procedure for your gum health. It basically removes calculus and other debris. Though it has been, scaling is commonly routinely performed procedure, but still there are so many people who have a lot of doubts regarding this procedure. I will be discussing 5 of them, which are the most common questions that has been asked from my patients. So those 5 questions are: is scaling painful? Does scaling make teeth sensitive? Scaling weakens the teeth and makes them loose. Scaling causes gaps to increase, and cleaning is going to make me lose my enamel. So before going any further and answering these questions, let me tell you how and when is the time that you actually require cleaning to be performed, okay? So this is how your healthy gums look. They are pink firm and they do not bleed. Point to be noted here is that they do not bleed. As soon as the calculus starts developing, this is the hard structure that starts to develop around your teeth, and it starts to bleed. It is when gingivitis, that is the gum inflammation, that starts. So what happens is your gums starts to bleed. They become swollen and they are red. They're not pink anymore. So this is when you know that you are due for your dental scaling. And if at this point of time also you just neglect this and you don't visit your dentist, the calculus keeps on building up. At this point of time, what happens is it starts eating your bone. Your bone is going to start receding. Your gums are going to start receding. Okay, so this is the stage when gingivitis actually progresses into periodontitis. So this is how it progresses from a healthy gum to gingivitis. Gingivitis is still a gum infection. If you visit your dentist at this point of time, no more bone loss is there, and then everything can be saved. If not, then it will definitely turn into periodontitis. It is going to be affecting your bone. So in periodontitis also, sometimes what happens is people don't come to us when they are feeling gaps. This is when you start feeling gaps between your teeth. There are so many of patients of mine who come to me and tell me that, recently I have seen that gaps are there in between my teeth. They were never there before. So this is the stage when periodontitis has already developed. But there are a few of the people who still neglect. They don't come to the dentist in the fear that, cleaning is going to deteriorate their conditions and it is going to make their teeth loose. It is going to transfer into advanced periodontitis. Then you can see hardly any root is inside the bone. Whole of the bone is lost. So gum starts to recede. Bone loss can be visibly seen. This is how gum starts receding. If you see the healthy gums and you see the receding gums, you will be able to see your root structure very, very clearly from your bare eyes. So there are so many of the people, who tell you that after scaling, your teeth is going to be loose. So most of those people come to us at the advanced periodontitis stage, when it was the calculus that was holding their teeth. And as soon as we remove the calculus from in between their teeth, there is no bone. They are already mobile. There is no bone that is present, and they assume that because of cleaning, their tooth has become mobile. If we get the deposits clean during the initial stage, guys, during gingivitis, then there is no chance of progression of it into periodontitis. Trust me on that. And there will be no bone loss. So now let me give you the answers for all those myths. Okay, so Is scaling painful? No, it's not a painful process. If you're coming to us during gingivitis stage, there is no root exposure, there is no bone loss, you'll not be feeling any kind of a pain, right? But still, if you feel that you are feeling some kind of a pain, you can always tell your dentist that to apply local anesthesia. We have local anesthesia based with us. We are not going to inject that to you. It's just a kind of a spray that we can give it to you. Second question is, does scaling make teeth sensitive? Sometimes yes, it does. If your roots are exposed, if you are in the stage of periodontitis and your roots, I can see your roots, yes, it can be sensitive, but it's just very temporary. There is a solution to every problem. If you have feeling any kind of sensitivity, you can always use sensitive pastes. I can always tell you the name of those if you want to know. Okay, you can write them down and I've answered those questions. Third question is, scaling weakens the teeth and make them loose? No, it's the neglect which makes the teeth loose. Now, I think you all are very aware of how the teeth is becoming loose. Number 4 question is, scaling causes gaps to increase between the teeth? Absolutely no. It's the calculus, which is not when removed, make us lose the teeth. The last is, cleaning of the teeth involves in removal of the enamel. That is the hardest structure. Okay, guys, so we cannot remove enamel with just a machine which is removing calculus. It is impossible. So the answer is complete no. So guys, it's not the scaling which leads to the mobility of the teeth, but it occurs when we do not get the calculus removal done on time, which in turn lead to the bone loss, and at the end we actually lose our teeth. Scaling is the most essential procedure, which is when done at the proper time, every 6 months. It is going to break the gum disease, the cycle of the gum disease, and further destruction of the bone is prevented. So don't be scared of the dental cleaning next time, guys. Now you have the answer to the question that does scaling weaken the teeth? I hope you guys have understood it completely. Still, you have any kind of questions, do not hesitate. Do not hesitate. I have just made this video so that I can clear all the doubts anyone around me is having. You can always write them down in the comment section below, and I will try to answer all the questions. Also, if you want to ask any other question, if you want me to make any other video regarding anything, like any dental topic that you are confused about, do let me know in the comment section. I will try to make the video for the same. Also, guys, just last thing that I want to tell you is that do not think that brushing can remove that hard deposits. It is very difficult. It cannot remove that hard deposits. Do visit your dentist. Do not be scared. Now you all know everything about scaling. Thank you for watching, guys. Bye. See you next week. Take care.